Good morning, and welcome to this week's episode of Ask Dr. Murphy's Public Health for You series. My name is Katie Berg. I'm a research study coordinator at the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing quite well, thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. We still would love to have any questions or comments down below in the comments or any of our social media linked. But we will start today with the headlines through today, November 21st, starting with a new study showing significantly reduced chance of long COVID in certain healthcare workers. Can you explain that data for us, Dr. Murphy?
Yeah, everyone is concerned, of course, on getting long COVID, as well as like trying to avoid getting infected. But there was a very large study published in Clinical Infectious Diseases. This is a Canadian study. 43,361 specimens were analyzed. So this is like a blood test thing. And looking at how strong the antibody response was in people who had vaccine or they had COVID or they didn't have any vaccine or never had COVID. So anyway, they found that with one vaccine COVID dose, there was a 75% effectiveness against getting symptomatic COVID and 91% effectiveness against long COVID. Two doses of the vaccine bumped it up to 95% against COVID and 87% against long COVID. With the hybrid immunity, in other words, if they had a COVID infection and they had at least one vaccine, that went up to 92%, so even higher for preventing long COVID. So it's just another reason to keep up with the vaccines. Even if you've had COVID, you still want to take the vaccine because that mixture is actually the thing that's going to do the best.
Mhm. And looking at another respiratory illness that we are headed for, the seasonal flu. Experts like yourself are worried this could be a more severe flu season. Why is that?
Yeah, well, these researchers, they looked at nearly 2,000 US adults that were hospitalized for flu between 2017 and 2020. And they analyzed all of them. And this is the CDC when they were working and doing their job. They found that the subtypes H3N2 and H1N1, which are the more severe types of flu, uh, in the study period was associated with a higher risk for ICU admission. So the other strains, they were bad, but they weren't as bad as when you had those two. And they did all these adjustments and everything, and it was higher. It was worse. And so what's floating around now? H3N2 and H1N1. So it's the same bad strains from a couple of years ago that were floating around. And so that's what's coming up because we follow the infection from the southern hemisphere to the northern hemisphere. It's already started, it's starting to pick up steam, and it'll really take off in December and go crazy in February and in January and part of March. So get your vaccine now because this is going to be a bad year for the flu.
Absolutely. Those flu shots will be very important. And speaking of flu shots, there's some really exciting, excellent study data just published about the new formulation mRNA flu shot that we could have in the future. Can you tell us about it?
Yeah, mRNA is just a technology. It's actually been around for over 20 years, and it really became well known during the COVID pandemic in 2020 when they used that technology to get the first COVID vaccines out. It's a much more sophisticated technology. Those Pfizer and Moderna shots for COVID were given to literally billions of people, and they are safe, and they are RNA vaccines. They're not DNA vaccines. They don't interfere with your DNA or anything like that. But anyway, so looking at the flu, this is just a technology. It's not hooked up to COVID. It's technology. You could make a vaccine, this kind of vaccine with almost for anything. They looked at the new experimental mRNA vaccine in more than 18,000 adults during the 22-23 flu season, and they found that the mRNA vaccine, this newer technology, prevented 60 to 67% of all flu infections. This is a study that compared the mRNA technology to the routine flu technology, which has flu vaccine technology, which is decades old. The conventional vaccines prevented only 44 to 54% of infections. So it's markedly better than the original one. Now, there's just all this anti-mRNA vaccine thing. Well, okay, you can take the conventional one, but it's not going to work as good, and they're both safe. So it's up to you.
Really, really exciting news there. Hopefully, we will be seeing that mRNA flu shot on the market
Yeah, it's not
soon.
on the market yet, so you have to stick with what you have right now.
But sticking with the flu, this time avian flu, we have not seen a human avian flu case here in the US in many, many months. But that is now changed as there's a human case in Washington state. Can you tell us about it?
Yeah, so yeah, it's been quite a while since we had another avian flu case in a human. With mostly we had been finding them in dairy workers and people working around birds. But there was this person in Washington State, an older person who was very severely ill and remains hospitalized. The patient has a mixed backyard of domestic poultry at their home, and the wild birds do interact with the domestic birds, and that's probably where it came from. So again, it doesn't look like it's a human to human transmission, but it's still out there, and there's yet another case of avian flu.
And this one is a little interesting because it seems like this may be the first human H5N5 infection
Right.
here in the US.
Yeah, there are
What's the
different
difference
variations.
between these strains?
Yeah, there's a few different strains of avian flu, just like there are a few different strains of the regular flu. And so no, we have not seen that this particular strain. The Asian ones are also a different strain for the most part. So and the fatality rate is much higher in Asia. So we don't really know what this means because this is the first case. But this person has underlying disease, is older, very high risk.
We will stay as up to date as we can on that case and look for any updates that are given. But our old faithful, the measles outbreak, still going on this week. Can you bring us the latest update?
Yeah, so cases up, another 30 cases are up. So we have a total of 1,753 cases. 12% get hospitalized. We have the 3 deaths. Almost everybody's unvaccinated. Cases continue to rise, and outbreak on the Utah-Arizona border, where 201 cases have been identified. So it looks like measles is just here to stay. This is going to be a recurring thing because the vaccination rate for measles continues to decrease. And as long as that decreases, everybody who hasn't had measles is at risk. Highly, highly contagious, 12% hospitalization rate, 1 to 2 per thousand die. That's just what we're going to have to live with in this current environment.
Yeah,
You
it's
don't have
a
to worry about it though if you take the vaccine. If you take the vaccine, you'll be protected. Works very well.
yeah, it's a new reality we're getting used to, and hopefully we see that vaccine uptake go up. But getting a quick update on a story from last week, more cases of infant botulism. Can you tell us all there is to know?
Yeah, they're up to 31 cases now, still no deaths. They do link it to By Heart Inc.'s whole nutrition infant formula, which only accounts for about 1% of all the formula in the United States. No deaths, but all 31 cases were hospitalized. This is life-threatening. So far, Texas has the most and California second, but they're the two biggest states. And we've got a couple cases each in several other states, including Illinois, which has 2. So if you've been exposed to that, if the baby gets all of a sudden can't swallow and gets floppy, they need to be evaluated very quickly.
Mhm. Now, another shocking number that we saw published this week was a near doubling of invasive pneumonia cases here in the US. Can you tell us about that and what people can do to protect themselves?
Yeah, so this is a, an analysis of pneumonia cases from a bacterial, and it's a streptococcal pneumonia, also called pneumococcus pneumonia. And it's actually a Dutch study um, that's very large. And they've looked from 2012 to 2024. And the incidence of invasive pneumonia from this bacteria doubled. It rose 100%. And there's two big problems with bacterial pneumonia. So it's not a virus, not like COVID or flu or RSV. This is a bacterial infection, the old community-acquired pneumonia. There are vaccines for pneumonia, and they do work, and they're getting better. So there's the standard pneumonia vaccine, and now there are two new ones. The Prevnar 20 is, I think, the most common right now. That includes another 54 to 58 strains of this bacteria. And there's another one called Capvaxive, and that covers 84% percent more, or 84 more strains. So, get whatever you can because these are really good and they're getting better. So the big issue is vaccination rates in general for everything are now down. So this is bad for trying to prevent pneumonia. And on the other hand, the newer vaccines have better coverage. So you want to have better coverage and take a vaccine. And since fewer people are taking the vaccines, we're having more and more infections. That's the problem. So the data are out there, and you can prevent this. We used to call pneumonia the old man's friend. This was a older man in a assisted living home or veterans home or something like that, and the most common cause of death, or a very common cause of death, was pneumonia. You got pneumonia, you couldn't handle it because if you're old and frail, man or woman, pneumonia can kill you. It's a potentially life-threatening infection. So keep up with the vaccines. The new ones are great. If you had the old one, that's great, but you have to take the new one now to expand your coverage.
Hmm. And unfortunately, our final story today is a sad one. A new analysis was done combining the effects of what could be the US and European funding cuts globally to highly affected groups. Can you tell us about this analysis?
Don't let anybody tell you otherwise. The massive cuts that the United States imposed on developing countries, especially low-income countries. So there's low income, medium income, and high income, especially in the low income countries, is devastating. And the Barcelona Institute has made a prediction that there could be as many as 22 million deaths, preventable deaths, because of these cuts in funding for HIV, TB, and malaria in particular. All those three are potentially lethal. If you look at a um, moderate aid reduction risk. In other words, if we can get more donors in to prop up the system, that number goes down to 9.4 million preventable deaths. So 9.4 million versus 22 million. Um, all just such huge numbers of preventable deaths. Um, and it's just terrible. It's just a humanitarian crisis. And don't let anybody tell you otherwise.
Yeah, this is an absolute public and global health disaster that we could see. That projection is by 2030. So this is in the next 5 years. We could see that many millions of deaths.
Mhm.
Truly, truly devastating and awful. But thank you, Dr. Murphy, for bringing us your expertise.
Half of those people are children also. Keep that in mind.
Yeah. Truly devastating. And thank you for bringing it to light. Thank you for bringing us all the latest information. It is much appreciated.
Thank you, Katie.
I hope you all have a great weekend. Thank you for joining us for the Ask Dr. Murphy Show, Public Health for You. We hope to see you back next week. Any questions or comments are welcome down below. And have a great holiday coming up here.